When was the last time you woke up, sat on the edge of your bed and stood up without hesitation? No sharp breath, no pause, no hand reaching for the nightstand just in case your knees didn't cooperate. For many people over 60, that smooth, effortless rise feels like a distant memory. What should be automatic has turned into a careful negotiation with your own body. You swing your legs over the mattress. Your feet touch the floor. And instantly, your knees feel older than the rest of you. Tight, sore, resistant, almost like they need permission to move. They protest with stiffness and ache, sometimes even a quiet grinding sound like hinges that haven't been used in years. And this is the part that truly troubles me. Most people quietly accept it. They shrug and say, "This is just aging," or "Everyone my age feels like this." They convince themselves that morning pain is simply the price of getting older. But I need you to hear this clearly today. That stiffness is not a punishment and it is not permanent. It is communication. Your knees are sending you a message. And if you listen early in the day, right when you wake up, you can change how they feel for the rest of it. That heavy, rusty feeling in the morning is not your future. It is a signal that your joints need gentle movement and activation before they're asked to carry your weight. And the best time to give them that help is before your feet even fully hit the ground. Today, I'm going to guide you through 5 simple, knee-friendly exercises designed specifically for the morning. They are gentle. They are safe. You won't need any equipment, and you won't need to lie on the floor. In fact, the first 2 exercises happen while you're still in bed. We're going to work through them in reverse order, from exercise number 5 down to number 1. And I saved the most important one for last, because it activates a small but critical muscle that most people completely overlook. Yet it plays a huge role in knee pain, stability, and confidence when walking. And stay with me until the end, because after the exercises I'll show you a 60-second morning habit that helps your joints move more smoothly from the inside out. Think of it like lubricating stiff machinery. It's simple, it costs nothing, and it starts helping immediately. So let's begin, slowly, intelligently, and with respect for where your body is right now. Exercise number 5, the bed heel slide. We're starting gently, exactly as your body needs first thing in the morning. You've been still for 7 or 8 hours. Your joints are cool. The natural lubricant inside your knees, called synovial fluid, has thickened overnight. Picture honey straight from the refrigerator. It's sticky and sluggish until it warms up. That's what happens inside your knees while you sleep. Before we ask them to support your body weight, we need to warm that fluid and get it moving again. Stay lying comfortably on your back. Keep one leg straight. With the other leg, slowly bend your knee by sliding your heel along the mattress toward your body. Let the mattress support the movement. Slide only as far as feels comfortable, no forcing, no strain. Then, just as slowly, slide the heel back out until the leg is straight again. This movement places almost no pressure on the knee joint. The bed reduces friction and load, allowing you to move through your natural range safely. What you're really doing is gently pumping fluid through the joint, helping it become warm and slippery again. Let's do it together. Right heel slides in. Feel the knee bend smoothly. Now slide it back out, controlled, calm, no rushing. Switch sides. Left heel slides in. Notice the motion, and slide it back out. Here's something important to remember. You do not need to bend deeply. If your knee only bends halfway, that's perfectly fine. Each morning may feel different. Some days you'll move more easily, some days less. The goal is movement, not perfection. Repeat this 10 times on each leg. It takes about 2 minutes. And by the time you finish, most people already notice that their knees feel warmer, looser, and less resistant, and you still haven't stood up yet. Exercise number 4. The lying quad set. We're staying in bed for this one. This exercise wakes up one of the most important muscles protecting your knees, the quadriceps, the large muscle at the front of your thigh. When this muscle is active, it acts like a built-in knee brace. When it's weak or offline, your knee joint takes the stress instead. And after a full night's sleep, your quadriceps is essentially still asleep. That's why those first few steps in the morning often hurt the most. Lie on your back with both legs straight. Now gently press the back of your knee down into the mattress. As you do this, you should feel the muscle on the front of your thigh tighten and firm up. Place a hand there if you like, you'll feel it activate. Hold that contraction for 5 seconds, 1, 2, 3, 4, 5. Then completely relax. That's one repetition. What you just did was an isometric contraction. The muscle works, but the joint doesn't move. This makes it incredibly safe even for people with arthritis or past knee surgery. Let's do another one together. Press the knee down. Feel the thigh tighten. Hold 2, 3, 4, 5, and fully release. Make sure you breathe normally. Don't hold your breath. Oxygen matters, especially first thing in the morning. Do 10 repetitions on each leg. By the end, your quadriceps will be awake, alert, and ready to support your knees when you stand. And that preparation makes a bigger difference than most people realize. We still have 3 powerful exercises to go, but your knees are already in a better place than they were just a few minutes ago. Exercise number 3, the seated knee extension. Now it's time to sit up. Gently swing your legs over the side of the bed, or sit on a sturdy chair if that feels better. Place both feet flat on the floor and sit tall, not slouched. From this position, slowly straighten your right leg out in front of you. Extend it until your knee is as straight as it comfortably allows. Let your toes angle slightly upward toward the ceiling. You should feel the front of your thigh working. Hold this position for 3 seconds. 1, 2, 3. Now slowly lower your foot back to the floor. Don't let it drop. Control the movement all the way down. That slow lowering phase is where a lot of strength is built. When you straighten your leg from a seated position, you're asking your quadriceps to work through its full range while supporting only the weight of your lower leg. This creates what we call functional strength, the kind you use for walking, climbing stairs, and standing up from a chair. Let's do it together. Right leg extends forward. Straighten it. Feel the muscle engage. Hold 2, 3. Now slowly bring it down. Switch to the left leg. Extend, hold, and lower with control. Here's a small detail that makes a big difference. At the very top of the movement, when your leg is straight, give the muscle one extra squeeze for just 1 second. Imagine pulling your kneecap upward by tightening the muscle above it. This targets a specific portion of the quadriceps that weakens quickly with age, yet plays a huge role in knee stability. Do 10 repetitions on each side. If one knee feels stiffer, start with the easier side first. That gives your body time to warm up before challenging the more sensitive knee. Exercise number 2, standing knee circles. Now we're going to stand, but don't worry, this movement is gentle and controlled. Stand near a wall or behind a chair so you can hold on for balance if needed. Bring your feet close together and bend your knees slightly. Just a small bend, no deep squatting. Place both hands on top of your kneecaps. From here, begin making slow, smooth circles with your knees. Move them gently to the right, forward, to the left, and back, as if you're stirring a pot. Keep the circles small. This is not about depth or strength. It's about motion. As your knees move in these circular patterns, the cartilage inside the joint is gently compressed and released from different angles. This spreads synovial fluid evenly across the joint surfaces, helping everything glide more smoothly. Do 10 slow circles in one direction. Then reverse and do 10 in the opposite direction. Pay close attention as you move. If you notice a particular point where the knee feels stiff, tight, or slightly clicky, Slow down there. Don't rush past it. That spot is asking for lubrication and patience. Over several days, many people notice those rough spots begin to soften and disappear. A quick safety note. If you've been told by your doctor to avoid rotational movements, or if you have a known meniscus injury, skip this exercise. Instead, simply increase the repetitions of the seated knee extension you just did. For everyone else, this is one of the most overlooked but effective ways to keep the knees healthy. Exercise number 1. Wall-supported mini squat with hold. This final exercise brings everything together. It activates a small but critical muscle that almost everyone over 60 has allowed to weaken without realizing it. This muscle sits on the inner side of your thigh just above the kneecap. When it's weak, the kneecap doesn't track properly as you walk or climb stairs. It drifts outward, increasing wear and pain. When this muscle is strong, it gently guides the kneecap into its natural groove. Stand with your back flat against a wall. Step your feet about a foot away from it, positioned shoulder width apart. Now slowly slide your back down the wall, bending your knees but stop early. You only want about a 30-degree bend. This is a shallow position, not a deep squat. This angle is important because this specific muscle works hardest in the first part of the bend. Going deeper shifts the work to larger muscles and reduces the benefit. Once you're in position, press your back firmly into the wall. Squeeze your thighs, especially the inner portion above the knees. Hold for 10 seconds. You may feel shaking or burning, that's normal. Let's count together. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly slide back up to standing. Shake out your legs and take a breath. Repeat this hold 5 times. If using the wall feels uncomfortable for your back, you can do the same movement while holding onto the back of a sturdy chair. The muscle activation is just as effective. We're almost done, but there's one final piece that makes everything you just did work even better. The 60-second morning joint booster. Before you leave your bedroom, I want to give you one final habit. It takes just 1 minute, but it dramatically increases the benefit of everything you just did. Here's something many people don't realize. The cartilage in your knees does not have its own blood supply. Muscles receive nutrients directly through blood vessels. Cartilage does not. It depends entirely on synovial fluid for nourishment. That fluid only moves when the joint moves. This is why morning motion is so powerful. But there's one more factor that matters just as much: hydration. After 7 or 8 hours of sleep, your body is naturally dehydrated. Your joint fluid is thicker. Your cartilage has been sitting in a reduced fluid environment all night. The exercises you just completed get that fluid circulating, but now we need to replenish it. Here's the simple protocol. As soon as you finish the exercises, drink 1 full glass of room temperature water, not ice cold. Room temperature water is absorbed more quickly and doesn't shock your system first thing in the morning. While you're drinking, slowly make 10 full ankle circles with each foot. Rotate through the entire range, slow and smooth. Those ankle circles keep blood flow moving through the lower body while hydration enters your system, supporting the knees from both directions. That's it, water and ankle circles. 60 seconds. Your complete morning knee routine easy recap. Here's the full sequence so you can follow it without overthinking. Still in bed, heel slides 10 each leg. Lying quad sets 10 each leg. These take about 4 minutes and prepare your knees for weight bearing. Sitting on the bed or chair, seated knee extensions 10 each leg. This builds functional strength through the full range of motion. Standing, knee circles 10 in each direction. This lubricates the joint from every angle. Final activation, wall-supported mini squat holds, 5 rounds of 10 seconds. This strengthens the inner stabilizing muscle that protects your kneecap. Finish 1 glass of room temperature water, 10 ankle circles per foot. Altogether, this routine takes about 8 to 10 minutes once you're familiar with it. I know how discouraging it can feel when pain greets you every morning. It can quietly convince you that your best days are behind you. But I see something different every single day. I see people in their 60s, 70s, even their 80s who begin with stiff, painful knees, and within just a couple of weeks of consistent mornings like this, start moving with confidence again. They walk more freely. They choose stairs without thinking twice. They get down on the floor with their grandchildren and get back up again. Your knees are not broken. They are simply undersupported. Starting tomorrow morning, that begins to change. Here's my challenge to you. Try this routine for 7 mornings in a row. Just 7. Mark it on your calendar. After those 7 days, come back and share what you noticed. Was the stiffness less intense? Did mornings feel easier by day 3 or 4? Your experience may be exactly what someone else needs to hear to get started. If this helped you, tapping the like button helps others find it too. And if you haven't subscribed yet, join us. We share practical, easy-to-follow health guidance every week. I wish you a smoother morning and a stronger step today. Take care of your knees, and they will take care of you.